This is Dr. Cruz interviewing Dr. Robert Harris. Dr. Harris has an interesting story about the journey with his heart challenges. Dr. Harris, will you educate our public on your journey?
Sure. In 1991, I had a heart attack, and I was taken to the hospital, and they did a cardiac cath, and I had significant blockages in the left anterior descending coronary artery, the right anterior descending coronary artery, and the circumflex artery. At that time, they did a balloon angioplasty on my left anterior descending artery. And then they diagnosed me with Wolff-Parkinson-White syndrome, which my mother also was diagnosed with. And I had several incidents over the years of tachycardia from the Wolff-Parkinson-White. And then one time when the tachycardia started, I couldn't get it to stop by things that I knew how to do, like sticking my face in ice water. And we went to the ER, and while I was there, it converted with me doing the Valsalva effect at the ER, but they wanted to keep me to make sure there wasn't something more serious wrong. So they did a cardiac cath the next day, and the caths were done by Norton's, and they were all on record, which is the physician, the cardiologist who did the cath on me. When he did the cath, he said, can you hear me? And I was slightly sedated, and I said yes. And he said, your arteries are all open now, and I've never seen anything like this before, because you had significant blockages and you don't have any anymore. What did you do? And so I started to tell him what I did, and then about 15 or 20 minutes later, I kind of came to, and there was a nurse standing there with a notepad, and I said, oh, I must have blacked out from the anesthesia. And she said, oh no, you've been talking the whole time. And so she said, you told us what you did. And I said, I told you about the chelation with Dr. Wolverton and then Dr. Cruz. And she said, yes. I said, and then I told you about the Linus Pauling protocol that I did with high-dose vitamin C with lysine, proline, and arginine. She said, yes. And so I went over that, and the cardiologist came back in the room and said he'd like to do a case study on me. And I said that'd be fine. And 3 months passed, and I didn't get any notifications from him, like, what's the case study? So I contacted him, and he finally called me back and said that, unfortunately, the case study on me and chelation in Kentucky wasn't going to happen.
So to review a little bit, you had your first heart attack when you were 45, and then when they checked your heart again, and your arteries were wide open, how many years had gone by, roughly?
Oh, from 91 till 2015, so 25 years. 25 years. So Dr. Harris, through dietary changes and exercise and doing IV chelation, opened up his arteries. And it's important to note that, because a lot of people have referred to IV chelation as quackery, but Dr. Harris had the good fortune of meeting Elmer Cranton, who's one of the first pioneers offering IV chelation for heart disease. And then he worked with Dr. Wolverton, who was the pioneer who brought IV chelation to southern Indiana, and then he continues to do IV chelation with us. And Dr. Gervasio Lamas is a well-known cardiologist, famous for the TAC study, and he's proven beyond a shadow of a doubt that IV chelation can reverse heart disease by removing heavy metals like lead, cadmium, mercury, and arsenic. But the interesting thing is that chelation is not legal in the state of Kentucky. It is legal in 46 other states, and that it's an underutilized therapy that can be extremely effective. And Dr. Harris at 75 can outwork most of us, and he's the picture of health, and he's done it with discipline and lifestyle changes and supplements.
And I think that's a message that doesn't get enough emphasis. So a lot of us could have a lot more health if we adopted some of Dr. Harris's habits. And we appreciate him sharing his expertise and knowledge with us. So thank you, Dr. Harris.
Well, thank you for your continuing care.